In this episode of the Toxic Mold podcast, Steve interviews Dr. Terri Fox, a holistic, integrative, functional medicine doctor and the founder of Boulder Holistic Medicine. Having completed her medical training at the University of California, San Francisco Medical School, Dr. Fox is board certified by the American Board of Integrative Holistic Medicine and has spent the last 20 years practicing functional medicine. Dr. Fox has experience in fatigue, bioidentical hormones, sleep disorders, gastrointestinal dysfunction, and chronic inflammatory response syndrome from mold toxicity and Lyme disease. She brings a unique blend of Western medicine, herbal medicine, nutrition and exercise counseling, supplements, and stress reduction techniques to provide her patients with a true holistic approach to healing. During this episode, Dr. Fox talks about her mold story and how her first major experience with mold came when her 8-year-old son went from being a thrill-seeking, rambunctious child to a little boy who didn't get out of bed for 6 months. This led her down a path of gaining a deeper understanding of the impact of mold toxicity on the body. In today's episode, Dr. Fox provides a wealth of information, including how mold toxicity is evaluated from a functional medicine perspective, strategies for detoxing mold, factors that can impact recovering from mold treatment considerations for women in particular, as well as how Dr. Fox can work with clients who are out of her home state of Colorado. This episode is jam-packed with information you're going to want to know. If you've ever gone to a traditional Western medicine doctor with mold concerns, or you're thinking about seeking out a doctor who can help you with mold illness considerations, this episode is one you are not going to want to miss. Before we get started on this episode, here's a not-so-short disclaimer. While all attempts have been made to verify the content provided in this podcast, neither the podcaster or the producers assume any responsibility for errors, omissions, or alternative interpretations of the issues discussed here. All information stated in this podcast is the opinion of Steve Worsley. Steve Worsley is a mold specialist with over 25 years of experience in the construction and mold industry. The Toxic Mold podcast is for information sharing purposes only. The views expressed are those of the podcaster and his alone. These views should not be taken as expert instruction or commands. While there may be references to medical conditions and symptoms, all podcast episodes are the opinion of Steve Worsley, and any medical questions or concerns shall be addressed with the appropriate licensed medical professional or professionals. As the podcaster refers to different mold types, please be aware that Steve Worsley is not a microbiologist, and questions concerning mold specifics should be answered by the appropriate professional. Steve isn't, nor does he offer any legal advice. For any legal advice, you must speak with a lawyer. The listener is 100% responsible for his or her own actions. You can check out Steve's books on Amazon. Just go to Amazon and search for author Steve Worsley. You can also take Steve's courses on Udemy or Skillshare, and you can find out more about those at cnccontractorservices.com. Now, let's get to the episode.
Hello. Welcome to the Toxic Mold podcast. We have actually 2 guests today. We have my wife, Cassandra, and we have Dr. Terri Fox, who is a functional medicine doctor. And Cassandra will actually start and give her or go through her bio. And we thank you, Dr. Fox, for being here.
Thanks for having me.
Welcome, Dr. Fox. I'm excited to talk to you today because there is so much talk about functional medicine and the importance of holistic medicine, especially when people are dealing with things like mold. And I also noticed that not only is your background from medical school to botanical medicine to taking a more holistic approach, but you've had a lot of experiences with a broad range of diseases that are connected directly to inflammation. So I'm interested to hear from you, like in your expertise in both doing functional medicine, but also in diseases that tend to be chronic and inflammatory in nature. How has mold impacted the way that you look at practicing medicine, but also personally, how has mold affected your life story?
started for me, the mold journey and the mold awareness, when my son was, I think it was about 8 years old, almost 9. And he was one of these real, like, thrill seeking, crazy, maniac little boys trying to jump off bridges and stuff like that, and kind of underweight. And he started limping, and he started getting like stiff and limping. And then I started testing him for things, and it turned out that he had Lyme disease. And then my Lyme doctor, who I flew him out to California to see Dr. Steve Harris, he had him do a mold test before we really started a lot of Lyme treatment. And the mold test was through the roof. And so I had suspicion in our house because I kept thinking I was smelling musty stuff, and I'd had several people in there and said that it was fine. And then this is, kind of a common story, which is why I'll go into the details of it. But there was some mold in the attic above his room, some water damage. And we went out of town. And while we did that, we had like a construction company come in and fix the water issue above his room and pull out, whatever, and just get it out of the house. But I didn't know about containment or remediation or any of that. So we came back to town, and he'd sort of been progressively getting worse and limping more and gaining weight in this weird way. And we came back into town after they had done that, and he didn't get out of bed for 6 months.
Wow.
He was in like 9 out of 10 pain, with a sort of like a migraine, but he'd never had anything like that before. And he was just down. So once we figured out he had mold, then I got a good remediation company out who did the whole evaluation of our house. And there was 3 feet of water under the entire crawl space, and it was under the vapor barrier. So we kept opening this one little thing and looking, and it looked fine. And so we didn't really realize. And because it was after, so Boulder had, the Boulder flood that year in September, and we had thought we had been okay in the flood, but it turns out there'd been 3 feet of water under the whole house for the whole time.
Wow. And
Yeah.
those floods happened in 2012, didn't they, or 2013?
Yeah. 2013, I want to say. Yeah.
Okay.
Yeah. In the fall. And we didn't realize until the next summer. And I'll point this out too, because it's rare, was our airborne spore traps were in the red, and all the way in the red, even for stacking. It was crazy. It was bad. Um,
Do you
but
happen to remember the spore counts or the raw counts? What numbers?
I just remember the color red.
Oh, okay. I was just curious because a lot of times when we see just, a really low number, like a raw count of 1 to 5, we typically look at that and say, was that a misreading by the lab technician, microbiologist, or is that really what it is? Once we get over that, like it's any stacky over 5 for a raw count, which is very low for the other mold types, we
Right.
we start throwing red flags and we're like, hey, we got some issues here.
So,
Right.
as a mother and a physician, when you learn that about the water being there for that long and the findings, what do you do at that point once you learn that?
Yeah, well, then I had to start learning about mold. Um, so I had been doing sort of functional medicine and doing a lot of fatigue and gut dysfunction and sleep and hormones, bioidentical hormones. And that worked for about 80% of my patients at that time. And about 20% didn't get better. And then over a few years, figured out all of those had Lyme disease. And so I ended up my practice, the line got bigger and bigger and bigger. And then you realize that if there's mold, if the person is exposed to mold or has any mold colonization, mold is such a complete attack on the immune system that Lyme becomes opportunistic and activates and replicates in the presence of mold. And so then mold sort of took over all the Lyme patients because, then I started testing them, and 2/3 of them all had mold. And then when you treat the mold, the Lyme goes back into dormancy, and all the Lyme symptoms go away, which is amazing and incredible. And so, yeah, I started learning back then, and, going to conferences. Back then it was just the American Academy of Environmental Medicine. And now there's a bunch of different organizations that we're all in. And now I would say I do primarily mold. My practice is probably 80% mold patients.
Okay. So you mentioned something that pretty much every one of my clients brings up, and it's Lyme's. And they say they were misdiagnosed. And of course, when they ask me questions, I'm like, hey, that's the
Right.
medical side of things. So you do have ways to differentiate between Lyme's disease and mold.
100%. They have a interconnectedness because that mold allows Lyme to go crazy. So if you have mold and you try to just treat the Lyme and you don't treat the mold, you'll never clear the Lyme. So
Okay.
there's this way that they relate to each other, but they're not the same thing at all. And yeah, the test for Lyme is the one I use mostly as a blood draw through IGeneX. And then the mold test is a urinary mycotoxin test.
Oh, okay.
There's a lot of overlap in symptoms, but there's certain symptoms that I find are more classically Lyme, and you don't really see with mold without Lyme in the background or underneath.
Right.
And so those you can kind of tease it out in clinic whether or not you think maybe Lyme was there too. But I actually don't even worry too much about it until we finish mold detox because a lot of times you don't have to treat the mold. It goes into dormancy and clears.
Oh, wow. That's interesting because
Yeah.
it kind of takes us into the next topic that we always talk about, and it's can you heal from mold toxicity while you're living in a home? And of course, from my perspective, and I know you agree, but it's interesting to hear your side of it because I always tell them, no, you must leave before you even start treatment. But you, when we had spoke prior, it said that actually we can start the process. Can you just kind of explain to our listeners that we want them to understand you can't keep living there? That's not going to work, in my opinion, if you want to heal. But on the other hand, you don't have to. I understand people can't just up and leave. You can start the process, correct?
Yes, I 100% think that you can. And yeah, I mean, people have to get out of the exposure if they're mold sensitive and if the house is bad and you can't remediate, and they won't get all the way better, at all when they're still in the moldy environment. But the way that I sort of explain it is the longer your exposure, the higher your load of mycotoxins and neurotoxins from the mold. And and there's other neurotoxins from the environment and glyphosate and plastics and pesticides. And then if you throw Lyme in there, there's biotoxin. And when it all like begins to overflow is when the patient gets symptomatic and, may even crash entirely. And so, from my perspective, you can begin taking that load back down before you're out of the house. Now, you may feel better on the right binders in the beginning of a mold protocol in the house. You may not because you're still being currently exposed. But if you don't start at that point, once you finally get out, there's just more of those to bind and get rid of. It just keeps accumulating, and so it'll just be longer. And often 2 weeks on the right binders, you'll get some improvement.
Okay.
Yeah. Even if they're in there, I mean, they're not like I said, like we both know, they're not going to get completely better unless they get out. But yeah, you can absolutely begin treatment. I
Okay.
do recommend they begin.
Okay.
Dr.
Yeah.
Fox, what would you suggest? I mean, I hear you talking about protocols because this is what you do.
Right.
And you come at it from a functional medicine. But there are so many people out there who go to a traditional GP, traditionally trained, not functional or holistic in nature, and their doctors tell them, mold, it's not a thing. Or no, we don't really. What would you recommend for someone listening or watching this who says, I went to my normal doctor and they poo-pooed my symptoms and my things away? What's your recommendation for managing that?
Yeah, it's really unfortunate. There's not a lot of awareness in the regular Western medical community at all about mold. I'm hoping that will change over time with all of us in this world trying to, get the word out. And I tell them to find somebody who knows what they're doing with mold. And I don't actually even tell them a functional medicine doc unless they do mold or biotoxin illness. So I have them go to, I'm a founding member of an organization called the International Society of Environmentally Acquired Illness. It's ICI. And there's a big long list of providers all over the country. And they're all people that do what I do. And we all share information and research, and we have conferences and all that stuff. And so ideally they can find somebody through ICI that who knows actually how to really treat mold. And if not, then yes, find a local functional medicine doc and see if they know anything about this. And, sometimes they will.
So we kind of skipped over probably one of the most important parts that intrigues me because, as I refer to myself, I'm the blue collar side of it. I don't have all the education like you do. And the testing part of it is made, from my point of view, as mold inspectors, we sometimes make a really big deal out of testing, which I don't believe, from my perspective on what we do, I don't believe that's really relevant on our side of things when we're doing air tests. And there's all sorts of testing we can do, the ERMI, we can do tape lifts, all that stuff. But and the reason to me it's not a big deal is because when we have mold infestations, we don't care what kind of mold is there. In my opinion, it doesn't have to be toxic mold, the black mold. Wet building materials can have tons of VOCs and off-gassing that can make you sick. But when it goes to the medical side of things, that's where I hear a lot in groups that I'm in and from my clients. Well, I used Great Plains, and I apologize, I'm not sure if that's a urine test or a blood test. And then other people will say, well, I use my MyCoLab. Can you explain to our listeners how you test and why you test the way you do?
Yeah, sure. So I do a urinary mycotoxin test. So mycotoxins are the toxin that mold excretes that is pathogenic to humans or causing to humans. And so it's a urinary mycotoxin test. There are markers in the blood that can sort of paint a picture of inflammation that would make mold suspicious. So if you're not sure initially what you're dealing with, and you don't know if it's mold, I might throw the biomarkers in the blood draw, the things you might have heard of like C4A or MMP9 or some of those. But I don't consider those as conclusive or definitive. So I do a urine mycotoxin test to see if there's actually mycotoxins in the system. I believe my myco is the one that is antibodies to mold. So it shows that you have IgG antibodies to mold. That to me doesn't tell me whether or not there's mold in the body. It means they've made an antibody to it at some point.
Right.
And is it still present? Is it, I don't know. And so at this point, I don't love that one or use it very much. I like the real-time labs one the best. The reason is because it's very specific, meaning there's not a lot of false positives from food or different things. And the downside is it's not as specific, it's not as sensitive. So it'll miss some of it, and so I provoke this test with a pretty dramatic provocation. So I have them come in for an IV of glutathione with some phosphatidylcholine, both of which heal the central nervous system, and they help you detox or pull out mycotoxins, and then we collect the urine after that.
Okay.
And if we're doing a retest, then the patient, I'll actually have them be on an antifungal medication for the test as well. So in theory, if you had mold colonized in the upper respiratory tract, so if you had colonized mold and you give somebody an antifungal medication that kills mold, it releases its contents, which are the mycotoxins and the nanoparticles and the stuff that make us sick. So I'll have them take their itraconazole or whatever antifungal that they're on or that they were on for the retest and do the IV. And then I feel like I'm getting a true real sense of what's in the system.
That makes a lot of sense because a lot of people will say, well, for the testing, and once again, I don't use the medical terms because I'm the blue collar guy, but they'll say, well, it's foods, it could be, something in foods. And you were very quick to say, just like I say about allergies, there's a huge difference between an allergy to mold and mold toxicity. And from what I understood, what you said about food, it's similar to that, where something in a food is not going to cause what mold exposure would. Is that correct?
Yes. You mean in the testing or in the
In the
person.
testing, yes, because they say that with the testing, the problem that you have is if there's a positive, and when I'm dealing with these people, I'm not dealing with them on a medical side of it. It's just my side of it. And they'll say, well, in a urine test, you're expelling those mycotoxins, but it could be from foods. And I guess my point is they try to say, well, it's not necessarily mold. It could be from food. And when I get into those conversations, that's why I kind of bring myself back into it and say, that's why you need an inspection. Like just doing the testing is not going to tell us much. But so to kind of come back to what I was saying is people want to poo-poo away mold in their home and blame it on the food they're eating because of the medical.
It's a lot more affordable if it was the food, right?
Yeah, that's true.
Um,
Put me out of
so
business
so
too.
there's a couple different kinds of urinary mycotoxin tests, and some of them have more cross reactivity with food, depending on the assay that they're using. I do not find that the real time labs has that. So occasionally you'll get, like, if I see just a little bump in aflatoxin, that's a mycotoxin that's pretty common in food and in nuts or your coffee beans or whatever. So if I see just a little bump in that, I don't even really worry about it.
Mhm.
It's the mold from water damaged building that's going to actually make you sick, that are truly pathogenic and crash a patient, entirely. And my personal belief is the amount of mycotoxins that we get in our food is a drop in the bucket next to living in a moldy building or environment.
Exactly. Okay. Yeah,
Yeah.
because that's like I try to be clear with my clients. As I said, it's this isn't a gender issue, but it's typically the men, and I'm obviously one, so I can speak for men, I guess. But it's usually the men that poo-poo it away, and they tell the wife or their significant other like it's fine, and it doesn't always have to be a man and a wife or a man and woman, but they just say no, it's the food you're eating because I'm not sick. And when I hear that, and it's probably one of the most common things I hear,
Oh,
it's
wow.
usually the wife that's having problems, and the children, husband's fine, and he wants to poo-poo it away and say it's just the food. And so I guess what I'm saying is it's a common excuse to not look into the actual home itself, which
Oh,
it,
interesting.
it's very interesting because that's just I think as humans we try to unless something's right in front of our faces, we don't want to admit that that's the problem. And it's like your situation, you had mold in an attic that you didn't even know about. You have 3 feet of water down in a crawl space, and you still it wasn't right in front of you. And so a lot of times food gets blamed on that. And so for our listeners, I want our listeners to understand food is kind of like an allergy to mold. It's a drop in the bucket compared to a moldy home, what I call a moldy home.
Well, that leads
Yeah,
me
I agree.
to a different question. Who is a good candidate for the kind of testing that you're talking about? I mean, is it when somebody thinks they have a mold issue in their home? Should people be doing this on a, yearly? Who's a good candidate for saying, yes, I should get that checkup or that testing?
Well, from my perspective, the way that I work, it's either, one of two things. Either they come in for fatigue and pain and different things. And, I start hearing the story and I start thinking, oh, they probably got mold or, whatever I think in my head. And so I'll recommend the testing right away if that's my suspicion. But yeah, I don't think everybody should do an annual test. Those of us that now know we're mold sensitive, those people they'll get symptomatic again once they're detoxed if they get back in mold, and then we retest them and we clean them. I mean, we detox them, but it's only a quarter of the population that gets sick from mold. So the people that get sick from mold are the ones that don't detox it and they can't metabolize it and get it out in the urine, the stool, and the sweat. And so it is really common for only 1% of the house to come to get sick. And so of course they'll say, well, it can't be the house because we're all fine. But that is the most common situation is one, maybe two people in the house. And so they don't think it's the house. And then I would always also say that when if I have a positive mold test on a patient, they always say it's not my house. I know I don't have any mold in my house. I'm 100% sure. And I'll do the whole like any musty smells, any history of water leaks, any old flooding, like, I'll do the whole thing. And then, they'll swear up and down it's not their house. And then I still tell them they have to get their house evaluated, because
Right.
if we don't, and I assume you're right, we're going to go down this, protocol, pretty lengthy protocol, and you're not going to get better. And then I'm going to make you test your house. And then 6 months of your life, is wasted. So, you have to really rule it out. Yeah.
And how often do you run into your clients that, let's say that they give Steve a call. I go out, we do an assessment, we don't find visible mold, we run air tests, we don't see anything that's a red flag. My next suggestion to my clients is, are you going to school somewhere? Where do you spend most of your time? Is it at work? How often do you find out that the exposure is not even at home?
Well, there's two pieces to that. One is it can be a previous exposure. Theoretically, you can colonize from a previous exposure. And so sometimes the person, like, in the intake, they will, reveal that, like, they first got sick in, let's say, 2015. And I'll start asking, well, where were you living in 2015? And when did you move? And so, or they might even know that they did live in a moldy space a few years ago. They got out, they never even thought about it afterwards. And then in our intake, they realized, oh, that's when I started getting sick.
Okay.
And so you can have a previous exposure. That happens a decent amount of the time. And then the other piece was, oh, yeah, home or office. I would say, in- maybe 15%.
Okay.
It's at a different place. Like, I've definitely seen it in like a vacation home in the mountains, or some kids at school, or other people when it's in their office. But it's more often like at home where you're sleeping, and now everybody's working from home. So if they had a moldy issue that they were maybe just treading water with, and then they work at home full time, then they get sick.
Right.
That it's too much. Yeah.
Something we cover quite often in a lot of the social media stuff that we do, my podcast. One thing I'm big on, and Cassandra's the one that actually, this things I don't think of, and I've gotten really big on journals. And it's very important that people that think they're getting sick, they have to start with something, because, what I tell them, and I'm sure it's the same for you, it's going to cost them a lot more money if they come to me and I ask questions and they just go, I don't know. And I'm like, okay, you're gonna have to pay us to go through all the protocols. If you can come to me or come to the doctor with we moved in 2013, that's when we started getting sick, or let's say we went to our summer home and we were sick all summer, got back home and we started feeling a little bit better, but we're still not feeling the best. I always tell them, I'm like, write these things down, because as frustrating as it is for me, I'm sure it's the same for you. It's very frustrating to hear, I don't know. It's like, well, then I don't know what to tell you either, And it's difficult. And like I said, if they can come to you at least with something, you have something to go off of.
Yeah, yeah. And I tend to pull the details out of them and take and try to figure out some, hints and parts of the puzzle and the timeline and all that to see if it lines up. And then I try to track as much as I can for them, because, patients tend to not remember the absence of symptoms. So, like,
Mhm.
if I have their 10 things they came to me with, and then I go, well, how are the migraines now? And they go, oh my gosh, I haven't had one in a month, but they didn't even remember that they were having them every day.
Right.
And then I definitely ask them to track. It's important in the treatment piece as well, because
Right.
you can go too hard, too fast, detoxing mold, and make somebody more sick. And so if they're not tracking and being careful, like going slowly and making sure that I have them go up on binders like real slow. Like, you start with one, make sure you feel nothing or better, and then you go up, and sort of, so it's kind of like, once the body begins to detox mold and you begin, like, let's say they're on binders and glutathione and that sort of thing, your cells get the signal that there's a way out, and your cells don't want these toxins. And so they'll start dumping. And if they dump more toxins, mycotoxins, biotoxin, then the body can get out in the urine, the stool, and the sweat. then they get more symptomatic and they feel worse. And in mold, it doesn't really help at all to suffer through that pain. Like you're
Right.
not getting there any faster, you're moving stuff around. So
Okay.
there's a boundary that we pay attention to. And so yeah, tracking from this perspective also is really important.
Right. So you bring up something that I wasn't even prepared to even ask this question, so forgive me if I use the wrong verbiage, but I see a lot of people that think that saunas, or there's these like little portable tents, and people ask me about it and I'm like, that's for your doctor. Do you have any recommendations for that, or is that helpful for
Infrared sauna, very helpful.
it is? Okay.
Yeah, you sweat out the mycotoxins. It's not going to do it by itself,
Okay.
but it helps a lot.
Okay.
Yeah.
And so for our listeners, obviously you still need to have the medical side of it. And speaking of that, so when I was looking through your website for your guys' clinic, you guys do sell a lot of the supplements and from my point of view, I tell my clients binders. Like I'm very clear, I don't get out of my wheelhouse. I'm like, that's the medical side. But you do sell those on your website?
Yeah. Yeah. We have a whole pharmacy here,
And do you
and you can do them on the website too.
So
Pardon?
do they have to have a prescription if they were to, let's just say I
Get binders?
what's that?
A prescription to get binders?
Yes.
No,
Okay.
no. But they should be guided. I mean,
Right.
so for me, so when we get the urinary mycotoxin result back, it has the different the trichoethicines and the ochratoxin A and the gliotoxin, the different classes of mycotoxins, and different mycotoxins have a different affinity for different binders.
Okay.
So that's why when somebody goes and they just go take cholestyramine or something, and they don't know what they've got, they don't get better because cholestyramine won't bind trichoethicines, for
Yep.
example, from black mold, and that might be what's making them so sick. And so it's more targeted. And the binders also have to be done 2 hours away on both sides from other meds and supplements, or it'll bind them and pull them out. They're constipating. The entire detox won't work if you get backed up. So you have to, work with them to increase magnesium citrate or whatever works for them for the daily movement. And so, I mean, it should sort of be guided, but no, I guess cholestyramine you need a prescription for, but like activated charcoal, bentonite clay, most of the other ones you don't need a prescription for. You can get them over the counter. Yeah. And you can get them on our it's not exactly our website. Like we don't have a pharmacy on there, but we have 2 online dispensaries
Hmm.
that, are through different organizations.
Right. So just for our listeners, just like I say, from our side of things, whether you're doing mold inspections or mold mitigation, you don't want to try it on your own. It's the same with yours. And the reason I was asking is if and it made sense how you explained it. There's so many people out there that say, well, I Googled this because, Google's a really great doctor. Like I've had like 5 degrees from Google.
And
So
now we have AI too.
yeah, exactly. So I actually got that not too long ago, and it's quite interesting just to ask questions. They read somewhere and just think that they can take some supplement that's going to fix everything. So you explaining everything's telling our listeners what I always tell them: you have to get the professionals involved. Like,
There's part of the protocols that you do have to have a prescription for.
what
Um,
are those?
the
Tip-
antifungals. Well, if they have a lot of ochratoxin A, I'll do cholestyramine as the binder. It's the best binder for that class.
Mhm.
And then once you get to, I do it in the phase 1 detox and then phase 2 detox. When you get to phase 2, we do antifungals.
Okay.
And so those are prescription.
For the process, because one of the other excuses I hear quite often is, well, it just takes forever to detox from mold, and sometimes you can't. I don't believe that, but for our listeners that know they're sick, but they're just not sure what to do. They think that it's going to take forever to get detoxed. How long is the average detox? Depending, I'm sure there's a lot of variables.
There's a lot of variables. But what I would like to say is that it's, what I tell my patients too is it's a really treatable diagnosis. Like people get better. The timeline varies depending on the house and the exposure and when it was and where it was. But post exposure, if you're no longer being exposed, 2 weeks on the right binders, you'll see a decent turnaround in the vast majority of patients with glutathione and some other things. And then once you get into phase 2 and you start antifungals, you get another massive turnaround. And so if they're being exposed and they have to get their house remediated or move out, like that's an entirely different timeline with a lot of variables. But let's just say they're no longer being exposed. It depends on like how high their levels are, how sick they are, how long it's been there. I would say it's probably 6 months to a year.
Okay.
Sometimes more, depending on what else is in the case and, part of the issue. But yeah, it varies. And I always tell people like, once we start phase 1 and I see how you do, then I can give you a better sense. And once we start phase 2, I can give you a better sense. So for example, in phase 1 is when I start binders and glutathione. If somebody tells me they can't do 2, caps of activated charcoal, they can only do 1 or they get symptomatic, it's going to be a really long road.
Okay.
But if they go from 1 to 6, no problem, they take full doses of glutathione, feel better, like they're going to move pretty quickly and get better quicker. But outside of it being in your home and how expensive and what a nightmare like that can be, where, you know, where you come in and save the day, outside of that part, it's not a bad answer for people who are sick. I mean, it's really treatable, not that long of a turnaround. You don't get worse before you get better, like you do with Lyme or some other chronic illnesses.
Okay.
If it's done right, it's really pretty painless. It's complicated, and there's a lot of stuff you have to take, and 2 hours away from meds and supplements, or something, a nasal spray up the nose, or something on an empty stomach. So it's complex, but it's like a quick turnaround, and people do really, really well.
It's I guess what I want our listeners to know and understand is it's very treatable. A lot of
100%.
times they think it's the end of the world, and
They Google, and
yeah,
then they
yeah,
think they're going to get kidney cancer,
yeah, and
whatever.
or they see, I'm not sure if you saw the special on like 48 Hours Investigates. It was a younger family out of Texas. They were living in a home. It was a husband and wife. I think the husband and wife were in their 40s, and they had a teenage boy. Wife wasn't experiencing anything. It was brand new construction. The husband was having memory problems. The son had same symptoms that you were talking about with your son. Come to find out, it was brand new construction, and they had off the charts. Like, once again, this is where testing to me is irrelevant. When we see a bunch of mold, we need to just address
Right.
it. We don't care about the test. But the big part of that story that had come out was the husband ended up having, they said, permanent memory loss. Do you see permanent things like a memory loss or anything that's permanent?
Let's say if it's just mold, because my patients tend to have a myriad of things. So if it's really primarily just mold, no, I think when done right, I don't ever see permanent stuff.
Okay. So there would be other players like maybe, I don't know.
Other neurotoxins, heavy metals, environmental toxins, other things that, all together, you might not get 100% back, but you mostly. It's the
Right.
ones that have the line that's active that, get more complex and, might get 90% better and still have 10% of something that doesn't get all the way better. But I don't find that in mold.
Okay.
The people that got partially better and not all the way better, they didn't do it right.
Okay.
They never did the antifungal piece or the biofilm piece or the final parts
Yeah.
that actually rid the system.
In that special, and it's been years ago that I watched it. Of course, they never covered the medical side of it. But from what you're saying,
Um,
I understand that if you were treating those patients, you would say, hey, there's something else. This isn't directly from mold. Is that a
well, I
good?
would get them completely detoxed from mold, get a negative test, and then I would, have to say that, yeah, you don't have any mold left. So let's look at what else is going on in the system. And
Okay.
usually we know where we're going by there because I've been working with them for a little while.
Okay. So that brings up another, I'm throwing you all sorts of questions, but say that you're treating a patient, they don't seem to be responding well. They don't think they have a mold problem in their home. We go out there, any professional, there's plenty of us. We go out to the property, we run air testing, we do a very thorough inspection. When I say thorough, we're using infrared cameras, moisture meters, bore scopes. We're really, which is what a mold inspection is. So for our listeners, that's why you hire a mold inspector that knows what they're doing. But anyhow, we go out there, we don't see any water damage, we don't see anything. From my perspective, I always tell my clients, we have to go to other things like VOCs or heavy metals or things like that. Do you have a way from the medical side to know if it is still a mold concern, that maybe it might not be at their home, it could be at their workplace? That's a complex question, but when you're treating them and they're still
Yeah.
not responding, do you know it's still mold once you've treated all of that?
So there's a couple like markers and things that you can look at to see. So, for example, I think you're saying like if they're not getting better,
Hmm.
then do you start looking at other things? So if they've had their home evaluated, by a good person and it really looks clear, and then they could do a little ERMI on their cubicle at the office or at, the school or something, just to see if it looks particularly awful, to see if that might be where. But yeah, and then there's also in the blood, there's a C4A, which is a biomarker for mold exposure. And like I said before, it's not a perfect marker, but if it was high in the beginning and it's coming down as you're going through detox, then you feel pretty good that you're on the right track. Did I answer the question?
Yes. Yeah, because a lot of times, like with my clients, from what I experience is they go through with what the doctor's recommendations are, which we're not going to go down that rabbit hole. It could have been wrong how they were being treated. They look at the structure itself. We go in there and I say, hey, from what I'm seeing, everything looks good. We're not seeing anything off the charts. And to expand a little bit, like we can do wall cavity testing. There's the ERMI testing. There's testing that I prefer. Doesn't make it right or wrong. But
Right.
at the end of the day, like the inspection's more important than anything to me,
Yeah, I think
because
so
the
too.
property conditions are what really matter.
Yeah.
But then they say, well, so then what is it? And I just have to respond and say, I don't know. And from the medical side, that's all I was trying to get at is we, from what you told me, you can rule out mold. You can say, hey, it's not
Yeah,
your mold.
exactly. I can't say whether or not it's in their house. I can say whether or not it's in their body. So they're
Yes.
either breathing it out in their house and then peeing it out and we're seeing it in the urine, or they've colonized from a previous exposure. So
Yes.
I'm coming at it from like the opposite timeline where I already have a mold test. I know it's positive. And
Right.
then I get someone like you, ideally, to go out to their house. And
Hmm.
then if they get a clean bill there, then we assume it's previous exposure.
Okay.
Yeah.
So Dr. Fox, I'd love to talk about mold in women's health, because I'm seeing a
Mhm.
lot of things in the research that are emerging around mold and fertility. And in a world where we have so many endocrine disruptors, perimenopause, menopause, pregnancy, what is your take on mold and women's health specifically? Does mold, especially for women who are trying to get pregnant, perimenopause, menopause, does mold look different in women?
Oh, does it look different in women? Oh, I'm not sure if it does. I mean, it's an endocrine disruptor, so it will, mess up your hormones. And all my mold patients have hormonal issues, whether they're men or women. But almost all of them have no thyroid. Very little thyroid function. The women tend to have low progesterone. But when your progesterone is low, you'll get more anxiety, insomnia, irritability, anger, impatience. Your periods will get irregular, more heavy, more painful, and that can be explained by what the mold does in the brain, but also even just what it does to the adrenals, putting you in a fight or flight when you don't feel well. And then cortisol and progesterone convert to each other, so that can take the progesterone. And men, you see, they have very low testosterone as well. And so it's very common to see the hormones completely out of balance. And I always tell my patients, like, we're going to strengthen the system enough to get you to be able to tolerate treatment and detoxification. And in the end, you might not need thyroid forever. But right now, when you've got none, your system's going to be a lot stronger and be able to get better if we just feed it like what it's missing, like what it's depleted in. And then that, the pregnancy part is so hard because you can't really do much. So anything you were to detox would go straight to the baby. And same with breastfeeding. So you never want to detox during pregnancy or during nursing. So I've definitely had a few cases where, I had a recent one that I just saw yesterday, I think, and she had come to me after being like sick for a while and years. And then we, got her diagnosis. We figured out it's mold. I start her on the detox protocol. And 2 weeks later, she finds out she's pregnant. And I'm like, okay, stop all of it. So you can have a little glutathione and we'll come back to me later. And she just came done breastfeeding and is like, help, help me get better. But it's a smart thing for women to think about before getting pregnant to detox, mold or environmental toxins, heavy metals, anything that they can, because it does go straight to the placenta. Most toxins do. I don't know if you've ever seen those stats on the number of chemicals in the cord blood, the cord from mama to baby, thousands of different chemicals. It's so distressing when you see it. So any pre-conception detoxification that people can do, it's a world of good for your baby and yourself, but you can't do it during.
Wow. That's important for women to know.
It is, and most don't. And I think it's sort of hard to convince a young woman that wants to get pregnant that she ought to wait a year and test herself for every toxins and do this whole thing, But ideally, that's what would happen.
That's interesting. So probably one of the biggest questions I would think if our, the audience that listens to this podcast, they need to hear it from the doctor. A lot of them want to know, well, can I be treated remotely? Tell our listeners so they don't have to hear it just from me.
So I can do it virtually, but so remotely being out of state. So I can't technically treat somebody in a state that I'm not licensed in.
Right.
And so
it should have been clear. That's what I meant. Like,
yeah,
you can't. Whereas I can do.
I can though, if people are willing to fly in once a year.
Yep.
There are, if I see them in clinic and I get to do a physical and there's a little wiggle room there, but yeah.
Yeah, because see, because I can do it. I can consult and do a VPA, a virtual property assessment.
I just listened to your podcast on the VPA yesterday.
Oh, did you?
Yeah, I was like, oh, cool.
Thanks to COVID, Cassandra's the one that told me. She's like, you know what? A lot of my clients, like I have clients and people I deal with in Kuwait and all across the globe. I think there's plenty of room for all of us. Mold is so much, I think it's ignored intentionally. But anyhow, they say, I don't know, like the guy I hire, I don't trust, or gal or whoever's doing it. And so the VPA, I was like, well, it's not me on site, and I'll come do a VPA on site. It's just going to cost you a lot of money, and I can do that. Whereas you can't, you can't fly to Wyoming if you're not licensed or whatever state and do it. Whereas I can. And so for my listeners, they look at it and they go, well, how come Steve can do remotely, but Dr. Fox can't? Because that's what they want. And so you answered the question, like, if you'll fly in once a year, we can do that.
Well, and Dr. Fox, do you offer consulting or coaching? I know I coach around the globe, and I have a coach who's not local to me. So are there opportunities to work with you that people who might not be in the state can take advantage of?
There are some ways. It's a little, it's a little different, and I have to sort of be careful with what I say, but, we can often figure something out with my partner here as well, Dr. Reedhead. There's usually something we could figure out, but I am trying to put together a course so that if somebody wants to mold detox and they can't fly in and they can't afford to see me and all that, that they could buy the course and do it on their own.
Perfect. Yeah, because most people don't realize the restrictions you have on the medical side, licensing and everything. We're based out of in Utah, Wyoming, Montana, Colorado. I actually looked up; they don't regulate our profession either. And
I don't know.
It's crazy that we're not regulated. And to not get into the political side of it, I mean, there's pros and cons to that. But on the medical side, a lot of people just don't understand. They can't just, consult with you and say, hey, can you take me on as a patient? And that's a lot of what my clients, they seem to think, I guess the best way for me to say it, they seem to think because I can do it remotely that you can. And until they hear it from the horse's mouth, they don't understand. Like, well, he can't really.
Well, and I would also think, Dr. Fox, that there may be a wait list to work with you. So even if people are willing to fly in, I'm assuming they can't just call and set an appointment for 2 weeks from now.
Yeah, no, I'm booked out for 3 or 4 months for a new patient. But sometimes, if the patient's really desperate, I do meet and greets. So it's free 15 minutes just to see if it's a good match and something I can help them with. And so sometimes if they're real sick and they can't get in for 4 months, I'll start them off on something in the meet and greet. I'll have them start doing the right testing and maybe start them on, there are certain things in the protocols that are pretty benign. Like when we were talking about binders, if somebody wanted to go buy activated charcoal because they thought they were being exposed, it's pretty benign. You just have to make sure that 2 hours on both sides, you're not, taking other meds and supplements and that you're not getting constipated. But yeah, I can often start them on a little something to get moving. And then my partner, Dr. Reedhead, is a nurse practitioner and she does mold as well. And she usually has openings sooner than I do.
Another very common question I get, I've already done the research and looked what you guys do, but once again, so they can hear it from you, is I'm assuming for the most part, their medical insurance doesn't cover any of the services.
No, it doesn't. We don't take insurance for my time. We will use their insurance for everything we can. So like I usually do a pretty big blood draw in the beginning. Like there's certain things that get depleted in mold. And like we were talking about before I do all the hormones and I'll do, basic nutrient panels and all of that. That gets billed directly to their insurance.
Okay.
And then some of the other specialty testing is contracted with insurance and they have to pay some portion, but none of the mold tests are covered.
Because that's probably one of the most common things. It's interesting to say that some of the testing is covered because my clients, most of the time, they tell me that their insurance won't cover anything. I probably should.
We get it covered whatever we need to. I mean, whatever we can,
Right.
And I should mention too, when we were talking just about different mold testing, that when a patient can't get the IV provocation, I also really like Vibrant. I don't know if you've heard of that one.
No.
It's another mycotoxin urinary test, and that one doesn't need to be provoked. So when somebody can't do the provocation that I like, I have them do the Vibrant.
Okay. Yes, for the most part, I try to stay totally out of the medical side, obviously for legal reasons. The biggest misconception that I think I see in my side of the mold field is someone thinks they can go get a test done and maybe they just did it on their own. And then they want to just send me the results and say, hey, Steve, what do you think? And I look at it and I go, okay, yeah, this can be from this, and this is from water damage, building materials. Or when it comes to the mold testing, from the medical testing, we could say, yeah, that's from Penicillium aspergillus. But my hands I shouldn't say they're tied, but I don't have enough information to even come up with any conclusions. And I guess my point is behind all that is when you're only doing one little test here and one little test there because you say you can't afford it, there's not much I can do. I'm sure you're similar to that. Like it boils down to you have to go see a doctor, and on the building side, you have to hire a competent mold inspector.
Competent, yes.
I mean,
there's a lot of people out there that don't do a complete evaluation, and
yeah,
Absolutely.
lots.
So, Dr. Fox, sometimes we get so much good information that we get analysis paralysis, and people will hear this episode and they'll say, "Oh my goodness, colonizing Lyme's disease is parasitic." They'll just they'll get stuck because they don't know what to do next. If somebody is listening or watching this, and you were to give them a piece of advice about maybe they suspect it is mold, what is one powerful next step they could take? What would you recommend?
So if they're not in Colorado, I would just say go ahead and do a urinary vibrant mycotoxin if you're suspecting that your illness is
From what
from
lab?
mold. Vibrant is the company, yeah.
Listeners,
And
I will put before we post this, I will put a link to Vibrant just for our listeners, so you know, in the description.
yeah, sure. And like I said, I love the real-time labs the best, but it does need a decent provocation or they might miss it.
Absolutely. So that would be their next step. Now, if
I would say, because then once they know it's mold, they've got their diagnosis, then they got to figure out if it's their house, they got to find a doc that can help them, and they kind of know what their, what the, core or root cause is of what's going on for them.
Absolutely. And so now, if they're in Colorado, what would you recommend?
Then I'd have them come in and get the IV provocation, the real-time lab ones. Yeah.
Okay. And they can reach you at boulderholistic.com at your website. They can, I went through it, looked at everything. They can book everything, or not book, but they can sign up online. They can call you guys. I'm assuming they have ways that they can in Colorado, and even if they're not in Colorado,
they can still reach out. Yeah. It's info@boulderholistic.com is the email.
And are there social media outlets where people can get and stay connected with you?
So we have a pretty big newsletter. We send out a lot of emails, campaign emails, just informing people, and blogs every week or two. And so there's a lot of information you can get just being on our newsletter. And then we have some Instagram and some Facebook. I wouldn't say we're fully focused on that yet. We do a bit of it.
It's still the newsletter that they can just go to your website and they can sign up for your
sign up. Yeah.
And will the newsletter be via the email sign up where they'll be the first to hear about your course once it's ready?
Yeah.
Okay.
Perfect. Yeah, definitely. That'll be announced. Yeah. Well, thank you so much for doing the work that you guys are doing. It's so important. And it's the whole other side of what I can't do that needs to be done. And like we said, not everybody's good at it. And I'm so grateful that you're out there and you're educating people and you're educating them about how to keep the house from even getting mold and water damage. So thanks for the work you do.
Thank you.
Thank you so much, Dr. Fox.
We appreciate you being on the Toxic Mold Podcast, Dr. Fox. You were very informative for all of our listeners. And thank you, Cassandra, for being here. Thank you, everyone, for listening to the Toxic Mold Podcast. Have a great day.
Thank you for listening to this episode. Make sure you go to our website at cnccontractorservices.com and sign up for the mold investigation checklist. Again, go to cnccontractorservices.com and get your free mold investigation checklist today. You can also on cnccontractorservices.com find out more about Steve's courses and books and consultations. Once again, go to cnccontractorservices.com.